Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Wynn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello, and welcome to another great episode of the Healthcare Connections podcast. I am your host, Jeremy Wynn, and this podcast is powered by Healthcare Compliance Pros. We're so excited to have our guest on today. We've got Brad Lund. He is the Executive Director of the Healthcare Billing and Management Association, also known as HBMA. So, Brad, welcome. We're excited to have you. I think it'd be worthwhile for the listeners to get a quick background of your experience and your career to this point and how you landed at HBMA.
Well, thanks for having me. I sure appreciate the opportunity. Um, in answer to your question, the journey was a long one. My background is in healthcare administration and law. And so I'm from Minnesota, and I started on the healthcare management side in the administration of hospitals and physician groups. Eventually made it to California. I joined a arbitration and mediation company called JAMS. I was chief operating officer of that company. And my neighbor, he had an association management company. I got very interested in that. And so I bought the company from him. And HBMA was my first client.
Oh, that's pretty awesome.
We've been together for a long time. So that's how I got here.
That's very cool. So HBMA was a client and eventually found yourself over on the HBMA side as the executive director. And how long have you been the executive director?
I was executive director for 14 years, and then I left for a few years, and now I've been back again for 4 years.
Okay, wonderful. Well, I'm sure the organization was thrilled when you came back.
Thrilled to be back.
Great. So some of the things I wanted to talk about today, first and foremost, there's a lot of trade associations in healthcare. And with your experience, I thought it'd be beneficial to have you talk through, what are some of the benefits for a group to be a part of a trade association such as HBMA?
Well, I was thinking about that question, and I know we only have a few minutes, so we have many benefits, but let me just hit on a few. I'm going to talk just a little bit about members helping members. I'm going to talk about how HBMA helps members in their marketing efforts, and I'm going to talk about education, what we do there. And most importantly, I'm going to talk about how we have brought value to the industry with the assistance of AC Pro. So our membership, helping members, we have what we call a message board. There's actually several message boards. And what it is, it's members posting up questions, concerns, challenges they have, and other members are helping them through those challenges. Just this morning, there was a post that a member was having issues with getting prior authorization approval from United Healthcare. And wouldn't you know, 5 minutes later, the answers to that problem came to that member. So the value is, that's one of the most amazing values we have as members helping members. Our members are always looking for new business. So we've got two different platforms with which providers can use to find billing companies that match their needs. One is a simple one. It's just a matter of putting in the state in which the practice or the hospital or other healthcare institution is at, and then it just gives them a list of all the members. A more dynamic tool is it's a template. And what the provider does, they fill out an RFI and they submit it, and the member has their parameters, the demographics of the billing company, and the system matches them up. So the provider then gets a more specific list of billing companies that match their needs. On the education side, we provide a national conference every year in September, and it's full of all kinds of education. And as important, there are 50 or 60 exhibitors that are in our exhibit hall that have all kinds of products and services that would make it easier for the RCM to be successful. We also put on an innovation conference every year, and that's focused on AI, RPA, or other technologies that are emerging that's going to be very impactful for our members. And finally, we put on an executive forum for the senior management of the revenue cycle management companies. It's a 2.5 day forum that helps them become the best they can be. Aside from that, we've got a distance learning program. We produce 20 to 25 webinars a year, and we have a learning management system where there are hundreds and hundreds of webinars on all aspects of the revenue cycle management industry. So those are some of the things that we're doing for member benefits. But I want to touch on one that's really important to us and dear to my heart. Uh, the RCM industry is a bit unique in that it's unlike if you're a doctor or a nurse or a physical therapist or any of these healthcare professionals. They're licensed. They have to earn a license. They have to maintain a license. That's not the case in the revenue cycle management industry. There are no rules. There are no regulations. And that makes it really difficult for a provider to select the RCM company that best fits their needs. Um, well, what we've done is we've developed two certification programs. One's called the CHBME, that stands for the Certified Healthcare Billing and Management Executive. And you have to pass a test of proficiency, and then you can earn credits. So every 3 years, you have to earn a certain amount of credits, and then you can recertify. That demonstrates that individuals within the billing company are committed to a sense of excellence for their clients. But the broader one is a program that we have designed with HC Pro. It's an accreditation program. It's independent from HBMA. It's run by and managed by HC Pro, and our members then go through that process. And they, at the end of it, if they achieve the accreditation, means they have complied with or are complying with the rules of regulations of the federal government, the HIPAAs, and all that. So that is a really important one. And I will say to you that I've talked to many members that hold that accreditation, and that's been the decision making aspect for the provider or the potential client. That when they understood that this company, the RCM company, achieved the accreditation through HC Pro, they got the business. So that was pretty impressive.
Yeah, and I can tell you from our perspective, in this partnership that we've been able to build together, we're constantly getting members of HBMA reaching out to us and saying, "Hey, I need to know more about this accreditation program because I either just lost a bid, I was trying to win some business, and the feedback I got was that we weren't accredited, and therefore that was a big driver." Or somebody coming to us and saying, I am placing a bid and they're asking me if we're accredited as part of the bid. And so, to your point, Brad, we're seeing it more and more that yes, there are many RCM companies out there. And as these physicians and as these groups are looking to choose one, they're looking for groups that have gone, taken those extra steps necessary to ensure that they're compliant, they're knowledgeable about the importance of HIPAA privacy and security, and that they're going to ultimately protect the data of their patients and not lead to any further issues down the line and potential audits, which are a nightmare for everybody.
Yes,
Nobody wants that. So we're seeing that as well, a constant flow of people asking about it on our side.
wonderful.
Yeah. So one of the things I was curious about, and we can touch on the accreditation piece here in a minute, and for those that are interested, but some of the advocacy efforts that you might be pursuing from HBMA. I don't know if there's any, one or two that maybe you'd want to highlight that would be meaningful.
I actually would. Thank you for asking that question. HBM is extremely active in the advocacy front, mostly on the federal level. We're trying to build better resources on the state level, but on the federal level, we're quite active both with CMS, the Center for Medicare and Medicaid Services, that runs Medicare and Medicaid programs, as well as Congress, both with the Senate and the House of Representatives. And there are some key committees that really drive the healthcare policies from a federal level, and so we're pretty close to them. We meet on a monthly basis, and then once a year we go to Baltimore and we meet in person with CMS, which we just did 3 weeks ago. And then after we meet at CMS, then we go down to Washington, D.C. and meet with the key congressional committees. And we've been doing this for 20 years, and we've developed some wonderful relationships. Um, It's kind of interesting. This year at CMS, we were meeting with one group. They run the MAC programs. They're the ones that are responsible for all the MACs that do the adjudication process for Medicare. The topic became focused on Change Healthcare and the cyber breach that happened with Change. This group was talking about they're going to develop a program, kind of like an accreditation program, that all clearinghouses are going to have to go through. And those that meet the privacy and security aspects of what CMS is looking for, they will be published as clearinghouses to do business with, and the others, not so much. The conversation then turned to revenue cycle management companies. As you know, we're not covered entities. Uh, what we are regarded as business associates to the healthcare provider. So they were starting to talk about what can we do to assure those same qualities in the revenue cycle management industry. And I said, we've already got it. We have an accreditation program that's managed by a third party that's well recognized as an accrediting body in the healthcare industry. And so we went into some detail on that, and they said, "Fine, we won't go any further. You guys are self-managing, and we're all for that."
So you're ahead of the curve a little bit, kind of getting out ahead of what others are doing. That's impressive.
Thanks to our work with HC Pro, it's been a wonderful relationship.
Yeah, it has been. So we're getting close on time. So let's touch on from our perspective at Healthcare Compliance Pros, that accreditation program. For those that are maybe curious to learn a little bit more, you can certainly reach out to our team or reach out to HBMA. You can get the information from either group. But we've talked about some of the advantages, the ability to win business. It's a huge competitive advantage we've found, but even more importantly, just to ensure that your company is compliant, that you're following all the regulations and federal guidelines that are out there is a big deal. And one of the services that the groups love is we do monthly exclusion monitoring checks. So not only do we monitor your employees against the SAM and the OIG exclusion lists, but we will also monitor the covered entities that you work with, so you can ensure that those groups you're doing billing for are also in a good spot from a federal perspective, that they're not hiring or doing anything that's going to compromise their relationship and ability to work with CMS. That's a huge deal for our RCM clients.
It is, and another one that I am so impressed with, and that is you've got a process by which you look at coding. And you're looking for, I guess, opportunities to be audited, by either the.
Where's the risk? Yeah, where's the potential risk in your coding practices that and look at you as if we're a payer? Yes, we have that ability, and a lot of our clients will utilize that service with us. You're exactly right.
Yeah, I think that preventing or at least mitigating any government litigation against an accredited billing company, it really is minimal in that area. And another thing, I haven't told Adam about this, but we are now working with a major insurance company. There's an insurance called Arizona Emissions and cybercrime insurance. It's difficult to get, and we're working with this insurance company that if you are an accredited member of HBMA through HC Pro, that you're going to get. We're talking about either discounts or better coverage, but it'll be very impactful in terms of the E&O insurance and cybercrime insurance.
Oh, that's amazing. That's a big deal. That's really exciting to hear. So in addition to all the other benefits, a new one coming. And just for those that are curious, one of the extra steps. So we've got a compliance program that we help you build for your organization, and we install that for you, and work with you and cover you on that. And then we have part of the accreditation is an additional HIPAA certification course. So we actually work with the organization to identify who at their company should take this course and complete this course. And that individual will then become a certified HIPAA compliance professional.
Mm-hmm.
So you can confidently go to your clients and say, yes, we have this accreditation. We have a certified HIPAA compliance professional on staff. And then in addition, you get a really cool plaque that we send to you for becoming accredited. You get what's really valuable is you get an HBMA accreditation seal that you can put onto your website, so people can see it and say, okay, they're accredited. I can trust them. We do a nice press release for you so everybody can hear about it. And then
Yeah,
every year, as you renew your accreditation, we'll send you an additional medallion that you can add to all the stuff you have. So it's a really fun program, really valuable, and sounds like even more value coming with this potential insurance opportunity, Brad.
yeah, we're delighted with this relationship.
Well, Brad, we're at our time for the day, but I'm really grateful to have you on today. My last question, we'll close with this, because I'm sure we're going to have some listeners that either just launched a billing company or are considering launching a billing company. Do you have one valuable tip or advice from Brad Lund and HBMA that you would suggest to them?
It's kind of really interesting you asked that question because that's never been a core focus of ours in the past. What we were trying to do is serve our members, and the company is the member, not just the CEO, but the entire company. So if you are a member of HBMA, everybody that works in the company is a member of HBMA. But we have recently decided that we need to help. The industry has actually shrunk quite a bit over the last decade. If there was 3,500 revenue cycle management companies, now there's 2,000. And I've often had that conversation with consultants, and they always laugh at me and they say, "Don't worry, because for every one that's getting bought up by a bigger company, there's another new one starting. So there's a constant um, supply of new revenue cycle management companies coming online." And I actually talk to a lot of people every week that are thinking about getting into it. We are building resources for how to start your billing company. What pieces do you need to have in place when you launch it? And of course, the biggest one is try to have at least one client before you open the doors. That's a good one.
Secure business first, yeah, before you really get
We will
rolling.
have a resource kit available for company or individuals that are thinking about starting a billing company. We will have all those resources there, so we'll have a whole roadmap from the start to the growth.
That's awesome. Well, we'll end on that. That's exciting, Brad. Thank you again for your time today. It was so fun to have you on the Healthcare Connections podcast.
Thank you so much for your time.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.